This is not the time for complacency. While we continue to receive encouraging news about COVID-19 vaccines and remain cautiously optimistic about the potential for new tools to start to arrive in the coming months, right now, we're extremely concerned by the surge in cases we're seeing in some countries, particularly in Europe and the Americas. Health workers and health systems are being pushed to the breaking point. WHO has issued guidance and tools to increase capacity for the medical and public health workforce and supplies and facilities to manage COVID-19 patients. At present, WHO has 150 emergency medical teams assisting countries in the planning and implementation of their emergency responses. WHO and partners are working with governments and health leaders to ensure that there is cover for health workers that are sick, that there are enough beds for COVID-19 patients and for essential services to continue safely, that there are enough masks, gloves, and other protective equipment, that governments have access to enough tests, therapeutics, and supplies to cope with demand now, and that health systems will be ready when safe and effective vaccines are rolled out. Health workers on the front lines have been stretched for months. They're exhausted. We must do all we can to protect them, especially during this period when the virus is spiking and patients are filling hospital beds. In this moment, when some governments have put all of society restrictions in place, there is once again a narrow window of time to strengthen key systems. We have seen that those countries which invested in case finding, care and isolation, cluster investigations, adequate testing with rapid results, contact tracing, and supported quarantine are facing much less disruption. Cluster investigations and contact tracing are part of the bedrock of a successful public health response. These actions help prevent individual cases from becoming clusters and clusters turning into community transmission. During recent Ebola outbreaks, the Democratic Republic of the Congo and WHO have invested in people and trained up a sizable number of contact tracers who work closely with local leaders and communities. And in just 2 days, in part down to active case finding and contact tracing, they will be able, I hope, to call an end to the most recent Ebola outbreak. As countries take extreme measures to curb the rapid spread of COVID-19, now is the time to invest in the systems that will prevent further waves of the virus. Invest in a well-trained and protected public health workforce so that you have enough contact tracers in place and ensure that those who are sick can isolate away from others and contacts are identified, notified, and managed properly. And where cases are starting to come down, keep investing so that you're prepared. This is a dangerous virus which can attack every system in the body. Those countries that are letting the virus run unchecked are playing with fire. First, there will be further needless deaths and suffering. Second, as we featured 2 weeks ago in a press conference, we're seeing a significant number of people experiencing long-term effects of the virus. Third, health workers in particular are facing extreme mental health pressure, and cases are severely burdening health systems in too many countries. Health workers went into medicine to save lives, as you know. We must avoid putting them into a situation where they have to make impossible choices about who gets care and who doesn't. We need to do everything we can to support health workers, keep schools open, protect the vulnerable, and safeguarding the economy. From calling up students, volunteers, and even National Guards to support the health response in times of crisis, to putting strict measures in place that allow pressure to be removed from the health system. There is no excuse for inaction. My message is very clear. Act fast, act now, act decisively.